Right, welcome everyone to the Husch Blackwell Health and Wellness in Healthcare Workplaces and How You Can Help. I'm Tom O'Day, a partner in Husch Blackwell's Labor and Employment Group. Thank you for joining our program today. Just a few housekeeping items on the front end. At the bottom of your audience console, there are multiple application icons for your use during the program today. If you have any questions during the webcast, please submit via the question box. We're going to be answering those. We'll be watching it, but we'll be answering questions throughout the webcast today. We've got a good number of people on the webinar, so we're not sure if we'll get to all of them, but if a fuller answer is needed, or if we run out of time to answer, we will respond at some point via email or a call. A PDF of the presentation materials is available in the Program Materials folder. The program has been approved for legal education hours, and to report hours, you can click on the CEU button and icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with the recording of the webcast for watching and sharing. Toward the end of the program, be sure to complete our short survey. We do review those. We do use your feedback to plan future programs and make sure that they're applicable to your business needs. Finally, this is a webinar that is the first in a series of webinars on health and wellness in the healthcare workplace. So please do watch for other webinars as they come up, and that's a good place for you to give input as to future topics if you put those in the survey at the end of the session today. So that's it for housekeeping items. Let's get started with our program. With me today are Rufino Gatan and Jen Foley. Rufino is Senior Counsel at Husch Blackwell in our Labor and Employment Group as well, a longtime colleague and friend. Rufino has significant experience representing clients in labor matters, including collective bargaining, labor arbitrations, unfair labor practice claims, and petitions for election. He's represented numerous clients before the National Labor Relations Board, OSHA, and the EEOC, and all of their wonderful state equivalents. Jen Foley is the Senior Director of Clinical Partnerships at Spring Health. She's a licensed clinician, certified employee assistance program professional, and certified professional coach with over 15 years of experience in behavioral health. She has worked in various clinical settings, including a substance abuse treatment setting, managed care facility, and as operations leader within an international EAP company. Jen is skilled in partnership with organizations to tackle employee emotional health and wellness strategy, supporting clinical intervention with crisis intervention, psychological assessments, motivational interviewing, and group therapy. So again, thanks for joining us. Please do use that Q&A function at the bottom of your screen. And with that, I'll hand it over to you, Jen.
Thank you, Tom, and thank you for that lovely introduction. I feel like I provided you a little bit too much information there. Basically, I've been in the field a little bit longer than I would care to admit, but I do have a focus in overall organizational health and wellness. You guys will probably see it come through in this conversation. I have a real passion for employee assistance programs. I was with a large traditional one for about 10 years prior to moving over to what I would call an innovative employee assistance program solution at this point in time. So I did just want to start off by talking a little bit about Spring Health, my current employer, and just recognizing that any employee assistance program you're working with, you're looking at a fairly altruistic benefit, right? From the organization's perspective, this is a way to truly demonstrate a level of care and concern for the employees and the family members that you're working with. Now, for those of us in the field or those of us having these types of conversations, we realize that there is that benefit that's a little less altruistic in that they are better able to provide good organizational support in the workplace, whether that's for each other, productivity, presenteeism, retention, all of those things. So just wanted to talk a little bit about that today, both from the overall perspective as well as, how it's a little bit different with Spring Health, in that making sure that we provide that best-in-class fit for the organizations we work with, for those members that we support, for their family members, that we're able to do it in a way that's really clear, right? We give you back that information, very data-driven, very aligned with making sure that there's a good organizational understanding, and of course, where that net positive ROI comes through. I'm going to talk about the importance of ROI, or return on investment, through our conversation today. Of course, I will highlight with Spring Health, we are the only solution that has clinically validated results showing that net positive ROI. But no matter whom you're having a conversation with, I want to make sure that we're keeping that light and focus on the importance of a true return on investment for the overall organization. What is Spring Health? I know I've said that we are an employee assistance program, which a lot of you are probably familiar with, but there's been a lot of different names throughout the years. What we're able to do is provide that that good quality mental health care or those other subsidiary type issues like working with individuals on social determinants of health or helping them with finding childcare resources, really that more wraparound encompassing care. We have some organizations where we work alongside like a more traditional EAP, or we're able to fully replace depending on the need of your individual tailored organization. And kind of what that has done in this space. And when you're looking at, I know I mentioned like traditional healthcare versus, an innovative healthcare, or as we're seeing in this slide, really a digital mental health solution. They really have popped up right before COVID. There started to be more work in the space, and that's great, right? You want to make sure that you're solving for some of the traditional issues where you have, large ghost networks where people are raising their hand and saying, hey, you know what, I'm really struggling, I need some help. And they're met with barriers, right? There's the resistance to change. There's not enough providers. There's not good data or outcomes. So with that, organizations started saying, we need a change, right? We need to do something different. Our people are struggling and they're not getting the help that they need. Of course, we all know COVID-19 was a huge motivator for that for a lot of organizations. And a lot of the digital solutions started popping up where they eliminated that struggle with fast access to care. If you take resources online, people are better able to schedule them. But really, that was not a main driving focus for Spring Health. Of course, we do want that quick access to care. We have an under 2-day average time to appointment with our clinical providers. But with that, we wanted to make sure that you're getting the right care at the right time. So we're taking a look from that individual member's perspective, from that individual leader's perspective, from that individual teenager's perspective, and making sure that you're getting good quality care that is actually right for you. And that's going to be really important anytime you're looking at mental health needs, is that you're not trying to put everybody into the same box, right? And I know that's hard because it's easier for us if we look at things in black and white, and I'm asking you to have some gray in looking at the mental health space, and then making sure that not only when you're looking at it from that individual member's perspective, but that we're taking into account individuals, their families, leadership teams, and overall organizational wellness. I know that Tom had mentioned when I started in the EAP field, I wound up leading a very large team. And I used to motivate them by saying, we have to understand that every interaction that we have, we're not only representing our organization, we're representing that individual member and their organization. We want to talk about those collaborative relationships and the best way to support one another. This is all summed up a little bit nicer on this slide, and just recognizing the importance and the drive between these types of relationships. And you can see from the circles that they are all related in one way or another. I know one of the things that was most impactful for me to hear is, like, as an employee, you are only as healthy as your least healthy child, right? Like, our focus is going to be on those relationships. And that works from a leadership perspective as well. Like, our team is only as healthy as our least healthy member on our team. So we want to make sure that we pay attention to the ways that we interact with each other, that we pay attention to offering support. And again, I do a lot of leadership trainings. It's not that we're asking managers to go out there and to solve mental health issues. We're asking them to be willing to have a conversation. We're asking them to be willing to say, you know what, I see you, I hear what you're saying, and I'm going to get you to the place that you can get some help. Just being that supportive person in somebody's life truly is life-changing if we can think about, people who have supported us in that way. And the more we're willing to foster and have these conversations, the healthier we're all going to be. And honestly, it's a spoiler alert for where I'm going, but also the better off it is for our organization from a financial perspective as well. Okay, so just to dive a little bit deeper into what does that actually look like? Well, from the spring health perspective, and you'll see with multiple mental health resources, these are all important to have that kind of full spectrum support, right? We want to, for us, we look at it as spring life and spring works. So all of the impact that you can have in your individual life, your family life, as well as the overall organizational and leadership impact. And you might be impacted by both sides of this coin, but in recognizing that you want full spectrum support. So what we're talking about is things like digital care. Like, is there a CBT, a digital cognitive behavioral therapy aspect to your program? Are you able to get quick access in the moment support through things like working on a sleep meditation or stress management? A lot of us are struggling with stress these days, pretty much everyone. So just to kind of recognize that there's that preventative measure, as well as that more in-depth clinical support. And I'll talk a little bit more about that. But when we're talking about clinical support, we are unique in our EAP that we offer medication management services. Not all do, but it is a way that you can add in addition to the therapy or the coaching type resources that you would expect. For Spring Health, I'll walk you through the personalized care plan, but just kind of understanding where the person is in the spectrum of clinical need, and then getting them aligned to that best quality care is going to be what you would look for in that type of program to really drive better clinical outcomes. And then, of course, we want to make sure that we're offering this from the leadership perspective as well. So we do trainings, webinars, that there's that individual management consultation piece, that there's an overall workplace support if you need a mandatory referral or a substance abuse evaluation requirement, that you're able to really provide that full spectrum of care throughout the organizations that you're working with, or the employees that you're focused on. One of the things that is really valuable as we're talking through what this looks like from that individualized perspective is that it's not cookie cutter. It's not everybody needs the same thing. We want to recognize, like I asked, to really hang out in that gray space, right? To have an understanding that even if Tom and I are struggling with some similar stressors in our life, it doesn't mean that we're incorporating them the same way. He might be talking through and working on coping skills with some close people in his community, where I might feel pretty isolated. Like, I might be struggling more, even though we're facing the same thing, because of the way that I'm coping with it, or because of my genetics or my previous trauma history, or whatever that might look like. We want to make sure that we're taking that into account. And you can do that through good quality assessments, right? At Spring Health, we do have precision mental health care, was one of our founding concepts. Dr. Adam Scheckraud created at Yale Psychiatry. So just being able to get that good starting point, a baseline assessment, it helps not only from that own individual member's perspective. So I might know that I'm not feeling quite like myself. I don't know what that means. Well, hopefully I do as a clinician, but in the general day-to-day population, you might just know that you're feeling off and not exactly what that is. Although one of my favorite colleagues that's not a clinician said, I never even realized that I was struggling with symptoms of ADHD until I took our assessment. And it was eye-opening for me. Like, it just made a lot more sense to have that type of background information. So the member gets that from their own perspective, but it also empowers our clinicians. We have a network of clinicians that we have one-to-one relationships with that work with our members, and they get those assessment data. So there's a starting baseline, and then they're able to reassess and really see the improvements in their own clinical outcomes. It also helps us with supporting to the right type of care. So if you're struggling and you're engaged with the therapist, but you're continuing to have more severe depression symptoms, okay, it looks like we need to also involve a medication management provider. Or maybe I'm doing great overall in my mental health. I'm very low acuity, but I'm really struggling with time management. Perfect. Let's get you set up with a coach so that we can really get that good quality, directed, actionable care. And I feel like I'm throwing a ton of information at you guys. So certainly if there's any questions, don't hesitate to drop them in the chat. Or even if you just need to tell me to slow down. I know I can talk very quickly, but typically, hopefully, I'm not too hard to understand. So part of what we do is really making sure that we're running pilots, that we're talking to the organizations that we're working with, that we're doing focus groups. And we're blessed to have over 11 million covered lives currently, and just really have a great sample size. So in part of that, we've taken a look at the overall members that we work with, organizations that we support, to really identify, okay, everybody wants to have, a good quality employee assistance program or good quality access to mental health care with their population. But what do these people want? What does this look like for them or from their perspective? And so when we talked with our members through focus groups and assessments, what we found is really the most important areas that they're identifying as, when I'm connecting with somebody, this is important or valuable to me. First and foremost, it's provider background. The ability to have somebody that you can have a shared lived experience with, or that the person is specialized in the areas that you are struggling. We actually do provider fit or provider matching, where we take that assessment data as well as demographics, and we recommend a couple of providers based off actual clinical outcomes. So the members that have reassessed, it's not just because, Jen Foley says she's really great at working with people with depression. It's that we look at the people that Jen Foley has counseled and how they have improved in their symptomatology, and we align those types of relationships. So with that, that was the first and foremost of importance. The next thing is time to appointment. How quickly can I get in? I know I mentioned that with spring, our average time to available appointment is under 2 days, but it is absolutely something that you would want to be working with your providers on, measuring, being able to report back on, because when somebody says, I need help, it does not help if that appointment is 6 weeks out. So there's actually a direct correlation between the person engaging in the provider session and the time it takes to get in. So just definitely something to be mindful. And then the third highest that we saw was session format. So whether somebody is going in person or virtual matters, about 15% of the time. So wanting to make sure that we take all those things into account. Organizations, overwhelmingly, so 56%. This was the highest that came back from that organizational side. And if you can think about this from a leadership perspective, the ability for my people to be able to connect with sufficient providers, that's really going to directly impact how they're relating with me, how they're relating with my team. If they're going out on a leave of absence, how quickly we're able to get that information back. So and then, of course, research, overwhelmingly, it's historically been the leading impact to positive outcomes is that therapeutic alliance. So wanting to make sure that you're able to connect with somebody who you feel like you can open up to, you can get good feedback from, is really a key driver there. Okay, so in part of that, I really wanted to talk about as well, what does it look like from the organization's perspective? How is some of the best ways to support in the workplace to make sure that when we're talking about this good quality access, that we're really advocating for healthy workplaces? And some of the most important things that we can do is make sure that we have folks that are aware. We have a lot of historical work that we've done with workplace care teams, or you might refer to them as on-site clinicians or in-house clinicians, but just ensuring that they really have the ability to help drive culture. That is one of the greatest things that I get to do in my job, is really be working with and meeting with leadership teams to talk about what's going on. What are you seeing? Here's what we're seeing in our data. Let's drive this training series. Or for populations, especially with frontline workers or in our healthcare spaces, where they need some more support with social determinants of health. And we'll talk a little bit about that and the impact that that has overall. But just being able to recognize, where are our struggles? Are we communicating about them? Are we able to help support that kind of full spectrum support? If people aren't able to meet their basic needs, that is going to impact their mental health. And at the same time, they're not going to be able to focus on improving their mental health until they can meet their basic needs. So just really making sure that we're taking a look and driving those outcomes within workplaces to help with that more company inclusive, that ability to train leadership, to work with the individual members. And a very cool way to do that is through in-house clinical programs. Okay, the reason why this stuff is so important, and if you can think about how this might even impact you, if you can think about, a manager that you've had who's been very good, or a manager you've had that maybe you've struggled with. Research has suggested in the Workforce Institution that 69% of managers had the greatest impact on the individual employee's mental health. That is more than your doctor or your therapist. And it is on par with your partner, the live-in person that you have in your life. So just recognizing that if we can have healthy relationships, right? Because typically managers don't ignore mental health issues because they don't care, right? They don't know what to do. They don't know how to say it, especially from that legal perspective of how much is too much? Am I crossing the line? They want to make sure that they are doing the right thing for themselves, for their organization. And sometimes that can be really scary. So we want to make sure that we're empowering them. We're having conversations about, it's okay to say, I'm not okay. It's okay to say, I don't have the answer, right? We don't have to solve everyone's problem in the moment. Just being there and being able to listen to somebody as they're telling you that they need that additional support can be incredibly helpful in that navigating next steps, in that just kind of help me get to the right place. I had somebody call me yesterday, actually, with one of our organizations and say, my employee called in last week. They had said that there was an issue with gun violence in their neighborhood. It was very scary to them, a frontline worker situation. Well, the employee comes back to work yesterday and says, yeah, we had gunfire in our house. My 3 small children were home. I'm afraid to go back there. It's an entirely different conversation. And this manager just wants to know, how can I best navigate my next steps with this person? How can I best connect them? What does this look like for us from an organizational perspective? They just want that support in making sure that they don't do or say the wrong thing. And from a human perspective, we are absolutely going to do and say the wrong thing sometimes, right? But we're trying to make sure that we can listen empathetically and that we can help them with that information, have that information handy. If you have a current employee assistance program, or being willing to advocate to your human resources or who would be appropriate for that type of support, and then being aware of what they should be offering, even just following up with the person, like, hey, do you want support in calling in? Or it sounded like you were going to call in. Is there anything I can do to help you with that? Making sure that they're having that positive experience can really go a long way. I know I had mentioned that really the importance of basic needs to prevent this ongoing and long-term or even chronic stress. 1 in 3 Americans are frequently or occasionally stressed over meeting these needs within their family. 1 in 3. So we are definitely working with folks that are in these types of struggles, or depending on, our income levels, our team income levels, that sort of thing. We might not be personally, but we know somebody who is. So recognizing the importance of food security is huge, right? I know a lot of us joke about inflation or the grocery prices going up, but there are a lot of people who are truly impacted by being able to secure food, social connection, and even somebody who seems outgoing or engaged might still be struggling with feeling isolated. So we just want to recognize that, the needs that these types of things have in our life, and that these truly are the top causes of stress. So transportation, housing, and food, those are all clearly social determinants of health. The loneliness epidemic is a real thing, so we want to make sure that we're paying attention to that. I know we do a lot of, trainings, outreach, support, just wanting to make sure that we're furthering those conversations. All right, so I will just briefly highlight another area where we see a lot of mental health and concern is with substance use disorder. Again, recognizing that there are just under 49 million adults in the US who are struggling with drug and alcohol use. That is a staggering number. And if you look at what that accounts to as far as the stigma that we might have. When I say somebody's struggling with drug addiction, a lot of times people have like kind of a face in mind in their heads of what that looks like. And honestly, 75% of those who are struggling are full-time employees. So they might not be aware that they've reached a level of dependence where they need help or that they're abusing drugs or alcohol, but they are based off the national definitions, and want to make sure that they're getting that support that they need. 50% of those who are struggling with substance abuse disorders are also struggling with another mental health disorder. I'm sure that that is not surprising, in that both substance use impact our brain functioning, our moods, our emotions, and then also a lot of times if we're struggling with anxiety, depression, bipolar, that we have the tendency to use drugs or alcohol to cope with those situations. I feel like that was a pretty dark and deep slide. Just recognizing, the importance of these centers of excellence. Spring Health, we have one for substance use. There's a lot of great ones out there. Just making sure that when you're looking for those types of programs, that again, you're keeping in mind the overall return on investment. You want to make sure that you are providing good quality care for your coworkers, employees, dependents, that sort of thing, but then also paying attention to what does that look like. I know I had mentioned at the beginning of our conversation that Spring Health really is the organization who has been able to develop that net positive ROI. So even with our costs incurred, you're still seeing a $2.20 return on investment. It's not because Spring Health says so and it's super fun to say, although it is. It does come from peer-reviewed studies that we've done, the 2023 Validation Institute. It's one of the largest mental health studies out there with over 10,000 participants over a 2-year time span, which was nice that we were able to do pre-COVID, during COVID, after, and looking at those measurements. But when you are spending money on good quality mental health services, you're going to receive a reduction in physical healthcare spend. So physical healthcare spend is where a lot of it does come out. What you're looking at is the key, the top places that we saw a reduction in spend with cancer, diabetes, and hypertension care. The overall total population still had that pretty significant reduction in spend. So also the reduction in mental health care. If you have the ability to help with good front end services for mental health care, you're going to have less acuity, high level spends like intensive outpatient, high out of network cost spend for substance abuse, or inpatient type care for others. So we do have some specialty in the large health systems. We have a partnership who's very active and vocal. I won't put names out there now, but in case anyone is on LinkedIn, we definitely do a lot of work with some large health systems. What we have been able to demonstrate is just under 28% employee enrollment to date, member satisfaction, again, measuring that therapeutic alliance. Are people able to get good quality care from their providers? We're at a 9.6 out of 10. For our entire book of business, it's at a 9.4 out of 10. 80% improvement on moderate depression symptoms, as well as being able to demonstrate with these organizations the exact reduction in healthcare costs that they've had. We're able to work with individual orgs to look at what does this mean for a financial ROI perspective for them in particular. This organization has occurred $7.8 million between that time frame of July 21st and June 22nd. That is a $3.8 million reduction in overall healthcare costs. The other $4 million comes from retention, productivity, and presenteeism. So just wanting to kind of highlight, as you're having these conversations or as you're thinking about these types of things, what you want to look for is what does that average engagement look like in spend, and then where are we getting that net positive ROI, or where are we getting that savings back as we're looking at good quality mental health care. All right. If there's questions or concerns, I'm happy to pass it back.
Great. Well, thanks, Jen. So we talked, and Jen kind of talked through the considerations about should you take some steps and additional steps perhaps for purposes of employee wellness and mental health. Now let's talk a little bit about how you get to that point where you can do it. And one of the more, I think, on point things, Jen, that you said is that managers don't ignore these kinds of issues with the employees that they're directing and supervising because they don't care. It's really because they just don't know how to deal with it. They're avoid of that risk of some kind of issue that comes along with it. And I think part of that is just making sure that all frontline managers understand the culture that you want as an organization. And then secondly, making sure that they are comfortable with what are our legal obligations, what am I required to do, what can I do, and then what are the risks? Because you could just clam up and not say anything, and that may be the best way to avoid risk on the legal side, but it's not going to help out with the culture that you're trying to build. So we're going to talk about two main areas of the law: FMLA, the Family Medical Leave Act on the federal level. There are, of course, individual state laws that are similar to or the same as the Family and Medical Leave Act, and then the Americans with Disabilities Act, which also has its own horde of state laws that are similar as well. We're not going to talk about kind of the nuts and bolts of FMLA in this presentation, but let's talk about how it's triggered. And for FMLA leave, an employee has to provide their employer with proper notice. It has to be appropriate, but it doesn't need to be some kind of formal application. It doesn't need to be inclusive of the words, I need FMLA leave. And there's really not a very strong defense if you're trying to argue that the employee just didn't ask for FMLA and therefore we don't need to give it. Something as simple as just asking for time off. If the information is such that the employer knows that the Family and Medical Leave Act may be appropriate, then it's an obligation of that manager, frontline manager, human resources, and others to make note of it and provide that. So the Department of Labor gives an example on their website, and I'll just run through that quickly. It's an employee with a spouse who's been previously healthy, but develops a serious health condition. And the employee comes in, tells the employer that she needs leave to care for the spouse because they've been hospitalized overnight, and it might be such that she needs to be out for the rest of this week and maybe into the next work week. And the Department of Labor has said, and it makes sense given the regulations, that that is enough information for an employer, for a manager hearing that for the first time, to understand that that's covered FMLA leave and that the employer needs to provide it. Now, if an employee says, you know, I'm really stressed out and need the rest of this week to just take a break, that probably and may be enough for them to qualify for FMLA and to put that burden on the employer to say, this is FMLA request, we need to provide this level of leave for the employee, and at least give them the paperwork to fill out with the medical provider to certify that they need that time and move through the FMLA process. So the Department of Labor has made clear, and I think, you know, most of us as human resources professionals or attorneys or executives within companies understand that mental health conditions are covered under the Family and Medical Leave Act. Generally, an employee who describes a mental health condition of anxiety, stress, bipolar disorder, whatever it might be, is likely to qualify and be available to take advantage of FMLA for a serious health condition. And the Department of Labor provided a couple just examples, triggering situations that are covered. It's things like flare-ups of a mental health condition, and that can lead to requests for intermittent or every once in a while kinds of leave under the FMLA. Another example is just generally appointments that an individual has with a therapist or a counselor or other medical provider. And the regulations require the employee to try and work with the employer so that those appointments aren't disruptive to the workplace, but ultimately the employee has the right to take that time. And if there isn't a way to avoid disruption in scheduling appointments, then the employee has the ability to take it. And that's difficult for managers to deal with. And I fully recognize that it's probably the most difficult thing for managers on the front line to deal with, is an employee who has some mental health condition that they can't see, haven't maybe experienced themselves, don't know much about, but that employee is entitled to these rights. And again, it's probably the most difficult issue to manage as a frontline employer. But overall, mental health conditions are covered by the Family and Medical Leave Act. Individuals have that right. And it's really difficult to manage because there are no accommodation requirements or opportunity for an employer to say, we can't accommodate an FMLA leave. The Family and Medical Leave Act just does not entertain the concept of an undue burden. Even if it's an essential function that the employee can't perform because of the medical condition, if they're covered by family and medical leave, that doesn't matter. And that has those real consequences in the workplace. But Congress has decided, and many of your states have decided, that it is a right, that individuals are entitled to it. And as long as they get that opportunity to go and see the medical provider and have a certification, they have the right to exercise that. And more employees are becoming aware of their rights. For whatever reason that may be, it's becoming more evident to employees that they have the opportunity to take advantage of the Family and Medical Leave Act as well for the time that they're covered, as well as disability laws, again, at the state or federal level. And you see here just from 2021 data from the EEOC, disability claims and those alleging mental health conditions are on a significant rise. Anxiety disorder claims have doubled. Post-traumatic stress disorder claims have tripled with the EEOC at the federal level. And I don't think that's a surprise necessarily for a lot of you, but it just highlights the fact that employees are recognizing it more. It's something that we as managers are going to need to address more and more in the workplace. So oftentimes you'll make that transition from a chronic condition, a chronic mental health condition that is covered under the Family and Medical Leave Act. And an individual may take chunks of time under the Family and Medical Leave Act. They may say, I need my full 12 weeks, or I need 4 weeks, or whatever the amount of time is in continuous leave when they're not in the workplace at all. Or the individual can take time intermittently as needed as a flare-up occurs or as appointments occur, or for whatever reason, as they need it, they can take that time intermittently under the Family and Medical Leave Act. And the same is under the disability laws at the federal and state level. They have the opportunity, even after family and medical leave has ended, to take that time under the Americans with Disabilities Act and state law as well. And generally, really quickly under the ADA, the individual employee has to be a qualified individual. Under federal law, they still have to be able to perform the essential duties of the job. And that's where we've got a little bit of a breaking point with FMLA. If an individual can't perform the essential functions of the job for their 12 weeks of FMLA, they're still entitled to that time off. If they can't perform the essential functions of the job when their FMLA leave ends, then it may be, and there's still a lot of individualized discussion and situational circumstances that you need to work through, but it may be a point where they're not entitled to leave under the Americans with Disabilities Act. But generally, the individual has to perform the essential functions of the job with or without an accommodation. An employer has the obligation, as does the employee, to participate in that interactive process to talk through what accommodations might be needed in order to allow them to perform those essential functions. And then employers generally have the obligation to provide reasonable accommodations for those employees. So I mentioned this idea of continuous leave under FMLA. It's somewhat of a surprise sometimes for frontline managers. Again, not probably for those of us in human resources on a regular basis. But once FMLA expires, once they've passed through those 12 weeks, they may still be entitled to a leave of absence past the 12 weeks. And that's sometimes hard for individual managers to understand. But the EEOC has been clear that maximum leave policies in an employee handbook, in separate policies, or even in practice that say we can only give up to 5 months of continuous leave as an accommodation and no more violate the Americans with Disabilities Act. So if you have a handbook or a policy or even a practice that says you're cut off and you're terminated if you can't come back after FMLA, it's almost certainly a violation of law. Even if you say, well, we'll let you stick around for 1 or 2 months, but at 5 months or 6 months of leave, you can't continue as an employee. That is likely a violation of the ADA as well. You have to have an individualized kind of determination. You have to provide leave until it becomes an undue hardship. And we'll talk through what that looks like. But you have to continue to collect that information from the employee and evaluate the opportunity for that employee to take that leave. We had a nice case, and it's not in these slides, but we'll talk about case law if you want it and examples from case law. There's a nice case now, maybe 5-6 years ago, in the Seventh Circuit Court of Appeals that covers the middle part, upper Midwest area, that said a 2 or 3 month continuous leave of absence after FMLA expires may be too much. That may be an undue burden for most employers. But if it's less than 2 months, you're probably in a position where you might need to continue that leave of absence. But once you're past FMLA, you have the opportunity to ask questions about it. Send letters to the employee asking them for information to receive from their physician or medical provider that can input your decision as to whether or not this is an undue burden and something you can manage. Intermittent leave is also something that is an accommodation under federal and most state disability laws. If the current job in which the individual is employed doesn't allow for, or intermittent leave doesn't work, in healthcare there's many situations where that intermittent leave might not work or can't be accommodated, then employers need to remember that you need to consider a transfer to another position, a similar position. The employee still needs to be qualified to do that work, but an employer has an obligation to look for similar positions as an accommodation. And if there aren't similar positions, you've got to look to vacant positions for which they might be qualified to perform, and potentially that reassignment to another position might be a reasonable accommodation. Now, this is different than family and medical leave in a significant part. When you're dealing with intermittent leave under FMLA, there are more restrictions as to what questions you can ask of a medical provider, restrictions as to what kinds of reassignments you can undertake. There's more flexibility with the Americans with Disabilities Act and state laws. Not great flexibility, but there is some. And an example I give is an ambulance provider client of ours had an employee who needed intermittent leave, but they were essentially the dispatcher for the ambulances. And the client's scheduling was such that they only had one dispatcher working a 12-hour shift. And to the extent that intermittent leave required the employee to leave the dispatch center, the only employee in person there, that had a very direct impact on the services that were provided. Patient care, of course, medical services were impacted, but under the Family and Medical Leave Act, it probably was something that employer had to manage through, and it meant potentially having a second person there, or at least available to cover those kinds of services. There's much more flexibility when you move over to the disability law. When the Family and Medical Leave Act time expires and you move into disability law, there's more room to address those kinds of intermittent leave issues. So let's talk through, under, again, disability law, where the undue hardship opportunity is there, what that looks like. And really what the undue hardship is a significant difficulty or expense to the organization as a whole. It has to be individualized, and you need to look at a number of different factors: the cost of accommodation, the overall impact that has on finances or operations. And really what it comes down to is disruption. And if you as a manager, if you as an organization can show, and if you can quantify disruption and how a reasonable accommodation or whatever the request is from the employee for an accommodation would disrupt the operations, then you can likely show an undue burden. And I would love for this slide just to blow up, for there to be a bunch of noise and things kind of shrapnel flying through the air. But ultimately, that is what an employer has to show, that there's been such disruption to the operation of the organization, to patient care in particular in healthcare. If you can get to that point of showing this affects patient care, that's an undue burden that we can't accommodate. That is ultimately where you can get to a point where you claim we can no longer accommodate that employee. And the EEOC has given some pretty good guidance on this. They've listed a number of different factors that courts have incorporated in their case law and their decisions. But this is how the EEOC quantifies and looks for disruption: the amount and length of leave, the frequency of leave, the impact on the employer's operations, and your ability to serve customers, clients, and patients in an appropriate manner. So that's where you need to get if it becomes a point where you think there is some kind of operational effect. You need to be able to rely on some of these types of factors in order to quantify that level of disruption. And to do that, you can engage in the interactive process. You can ask questions of employees under federal and state disability law. You have to do it the right way. You have to be reasonable about it. It has to have a connection, a nexus to the actual condition and the job. But you can ask questions of employees once you pass through the FMLA point in time. And this is often where we as attorneys are telling the human resources team or the executives to slow down, because it's really, you think of it in terms of a continuum. If you don't spend time in the interactive process, your risk of getting a complaint and potentially having liability is greater. The more time you spend in this interactive process, the more, the 2-week periods, if you've got 5 or 6 of them stacked up where you're asking the employee, can you come back yet? Are there any accommodations that will help us get you back yet? That helps when you're trying to fight off a claim, and if they do file a claim, when the actual claim is moving its way through the process. So to better protect the organization, you want to engage in that interactive process. Now, I tell you that a requirement for attendance in healthcare and specifically, but in all industries, is key. An employee who is providing direct care has an essential function of being present to provide that care. And there's a little bit of pushback and pull between the EEOC, where they say that it's attendance as an essential function is not always required. Courts, however, are more likely to say, yeah, we understand how being there present in person with regular attendance is an essential function. And both the EEOC and all the courts agree that a continuous leave of absence for some period of time that's not defined, for some indefinite period of time, is not reasonable. But if attendance is an essential function and you've put that in your job description and you can demonstrate that it is key and essential to the nature of the job, you're in a better position to say that it's an undue burden to allow that employee time to take as leave. Even the EEOC has recognized that irregular or unreliable attendance, or kind of open-ended schedules where you're coming in and out of the organization, is not something that an employer has to endure. But in order to get to that point where the EEOC agrees that the attendance is irregular, unreliable, or open-ended, you need to spend some time working through that interactive process, trying to work through different accommodations and trying to make it work for the employee. The other thing the EEOC has made clear is that undue hardship can't be based on patient fears or customer prejudices toward an individual's disability. The morale argument isn't something that really works for federal or most state agencies as well. But I think what you need to do in practice is turn that morale issue into a quantifiable disruption. It's not the complaints of the coworkers that are having to pick up the job duties of their coworker who's on leave. It's that they can't get to their work because they need to do all the work of their coworker. the number of patients they see in an hour is now 10 instead of when it used to be 6. And that has an impact, a disruption to our operations. Those are the kinds of levels that you need to dig into for purposes of employees impacted or the disruption. You can't just rely on morale of other employees. It has to be quantifiable in some way. So I'll skip through a couple examples. We've got a bunch of case illustrations that we talk about. We're not going to include them here, and we don't have them in this presentation, but if they are something that you do want to take a look at, we've got them already compiled and can send those off. Just send a note to us or make a note of that in the survey when we finish up with the webinar, and we can send those along. I did want to really quickly note one case from the Ninth Circuit Court of Appeals that's relatively recent. Generally, it is accepted that an employee complaining about their supervisor specifically and asking for an accommodation of a reassignment to another supervisor, that is not reasonable. In courts and the EEOC have said an accommodation of assignment to a different supervisor is unreasonable. That's not something that an employer is required to do. But the EEOC has said a supervisor might be obligated to change their methods of supervision. They might need to change how they interact with a person with a mental health condition under the federal or state disability laws. This case from the Ninth Circuit just recently was talking about an accommodation request for no contact with a coworker, which I thought was interesting. And I can see how individuals with depression or anxiety or some other kind of mental health condition might see that as a way to relieve some of those symptoms of those medical conditions. And the Ninth Circuit Court of Appeals considered it and ultimately said, in this situation where there's only one shift, where all employees need to work together, that's an unreasonable request to have an employer change its operation such that the employees don't have contact with each other. But what the Ninth Circuit refused to do is say it's never a reasonable accommodation. If an employee's on shift, the first shift, and there's a second shift available, a reasonable accommodation may be moving or offering at least to move that employee to a second shift. So somewhat of an interesting case, but it highlights those points of reassignment of a supervisor is for the most part not reasonable, and for the most part no contact accommodation requests between employees are not reasonable either. So a couple quick tips: be flexible with the employees. Again, it's built on culture. It's just a function of more employees coming into the workplace with mental health conditions. And ultimately, we need to make sure that managers are trained, like Jen said, to know where the lines are that they can or can't cross, but also empowered to do what they can in order to make employees more operationally efficient, able to do the job with their medical condition, with an accommodation if needed, so that it benefits both them and the organization as well. I tell you that the importance of communicating with the employee through their medical provider is significant. You want to have that interactive process. You can even try out accommodations. And the EEOC has clearly and expressly said you can try an accommodation. If it doesn't work and you realize it's unreasonable or becomes a burden, that's acceptable. And they probably would look better on an employer who tried out some of those different accommodations. And then make sure you're documenting that disruption or burden if there is one. Quantify it somehow. Don't just kind of listen to the employees complain and then talk about or document the complaints, but ask those employees who are complaining, how is this impacting your day-to-day? Are you working more overtime? How does that affect you as an employee? Those are the kinds of questions that you can ask in order to drive toward that quantification of disruption. And then the biggest takeaway for me that I'd recommend is adding regular, reliable attendance to your job descriptions. If that's there as an essential function in your job description, and if it's true, and for most patient care, direct service providers, it is true, put it in your job description. Revise those job descriptions to include essential functions like regular attendance, the ability to interact with coworkers, the ability to provide a comfortable environment for patients or customers, And those are things that you can rely on if you need to act on them moving forward. And then again, quantify that disruption, that impact, engage in the interactive process, try out those intermittent leave accommodations, and then remember to avoid those maximum leave policies where it's a black and white cutoff with respect to how much time an individual can take. All right, Rufino, I'll turn it over to you because you said you only needed a handful of minutes in order to wrap up.
Thanks, Tom. I appreciate it. And this is a part of the presentation where I like to say to save the best for last, but I think everybody would know that is not true. I usually drop the hammer with like that big scary stuff about what happens when employees are unhappy. Really the gist here, as you can see from the slide, is you can't please everyone, right? So then what is the next step? Now, if you finish that by thinking, so you've just got to please yourself, I applaud your lyrical knowledge of all things Rick Nelson. But that would be, at least from a legal standpoint, not the best answer. Really what the message here is, focus on employees, right? So what are the numbers like? Jen talked a lot about some of the issues that she has seen with regard to employee mental health issues and just sort of the general state of how employees are feeling burnout currently. And in particular, in the healthcare space, we have seen significant increases in employee burnout and just reporting of harassment. So if you see, in this slide, the number of employees and healthcare workers in particular who have reported harassment at work has doubled in just the last 6 years or so. That is a pretty big concern. It is something that drives employees to do lots of different things. Obviously, lawsuits and charges of discrimination and harassment are one of those issues, but the others are just, they look to leaving the workplace. And the last number on the right side of this slide, 44%, that is the number of healthcare employees who intend to look for a new job. And that was in 2022. That number increased by 33% also in a 4-year span. So those are all disruptions. Those are the kinds of things that employers generally want to avoid. And so just so that you all know as well, the source document was the CDC's morbidity and mortality weekly report from November 3rd of 2023. There's a link in the slide to that document if anybody wants to review it in more detail. But how can you help? How can you avoid being one of those employers who has such high reports of discrimination or harassment? So, when healthcare workers in particular are feeling supported, there's a lot lower incidence of those issues. So how can you support your employees? Allow them to participate in workplace decisions. One of the biggest drivers of employee dissatisfaction is the perception or the reality that they lack a voice in the workplace. And it's the little things. No sort of input is really too small. No issue is too small. If you're thinking about remodeling the break room, for example, let your employees have a say in the kind of toaster or microwave or whatever other issues you might be looking into for that potential remodel. All of those things create a level of trust between management and the employees. And when you build that trust, you really solidify your relationship with employees. If you haven't noticed, there is a common thread throughout our 3 presentations, and that is that your supervisors are really the key to all of these issues. So you want to train your supervisors to be proactive and to be helpful. Tom mentioned this issue of, sometimes employers don't realize that they've gotten sufficient notification about a request for leave. Well, typically that is because employers or supervisors tend to sort of dig their head in the sand, bury their head in the sand, and they think that the less information they get from employees, the better off they're going to be. That is generally not going to be a good response. So ask them to be proactive, ask them to intervene, make sure that they're asking their employees the right questions about how they're feeling, and try to create solutions to those problems. Now, this doesn't mean that you should always give the employees what they're requesting. Sometimes there are affordability issues. Sometimes there are just operational impracticalities to giving the solutions that they're requesting. But when you listen, when you create this loop of communication with employees, that really does impact all of those issues. Now, the main reason you should care, and I told you that I was going to do this, is all of those issues that Jen and that Tom just discussed. When we look at the reasons that employees seek union representation in the healthcare field in particular, it's all of those things, right? There's a significant overlap. It's staffing issues, people having to work long shifts or mandatory overtime. Those are big red flags that you as an employer can try to address, and try to get ahead of. But the perceived lack of voice in the working conditions is the next biggest factor. I can't tell you how many clients I've assisted with collective bargaining issues or union election campaigns where that is the driver for seeking third party representation as in a collective setting. It's this idea that I don't have a choice in or control over how my workday unfolds. If I had that, I wouldn't need to have looked for a union representative to help me achieve the goals that I want to achieve in the workplace. So all of those issues play into it. And ultimately, I use the term here, deficient supervision. I don't mean that to disparage supervisors in general. It's really more about not focusing on the issues that employees are usually, and certainly in today's environment, they're not shy about telling their supervisors what is going wrong in their day-to-day activities, right? So supervisors should be trained to listen, to report those issues to HR, to their own supervisors, so that the organization can create a cohesive plan for how to address all of those issues, and try to get ahead of them. So with that, I didn't see any questions in the Q&A, but certainly if you have any questions about any of the topics that we covered, by all means, please feel free to reach out to us, and we will be sure to get responses to you in a timely fashion.
Yeah, for sure. Well, thanks, Jen. Thanks, Rufino, for joining us today. And thank you all for joining us. We hope the information was helpful to you and to your individual organizations. Just quick reminders, program was approved for legal education hours. There's a CEU icon at the bottom of the screen that you can click on. A certificate of attendance and recording will be sent. And then make sure to complete the survey that'll come out. We do appreciate the feedback. We'd love to hear other ideas for webinar topics. And again, this is the first in a series of mental health and wellness issues and healthcare employment that we'll be addressing. So again, Rufino, Jen, thank you. And thanks to you all for joining.
Thanks all.